I think good morning, everyone. Welcome to our third series for our BOG prep, brought to you by California Association of Healthcare Leaders and San Diego Organizations of Healthcare Leaders. So for today, we will be tackling the management and leadership and business knowledge. And once again, we thank you for being with us today, and thank you for giving us some of your time on a Saturday morning. Before we dive into dive into our main topic or main agenda today, I would like us to reintroduce our committee members again. So I'm Michael DeCoco. I'm the chair for the CAL Member Advancement Committee.
Hi, good morning, everyone. My name is Thuy Do. I am a co-chair of the CAL Member Advancement Committee, and it's great to have you all here. Happy Saturday.
And Rick, you're mute.
Good morning, Rick Nered, professor at California State University, Chico, and been on this committee, it seems like forever.
Good morning, everyone. Sachin Gangupantala. I am the committee member on the CAL chapter here for Advancement Committee. Thank you.
Good morning, Nora Powers, member of the committee since forever also. Good to see everyone again this morning.
Next slide for our San Diego partners.
Good morning, everyone. This is Jessica Taylor. I'm the 2022 president of the San Diego Organization of Healthcare Leaders. Proud to have you all here with us. Thank you so much to Cal for partnering to provide this excellent program. I certainly do wish that I had been able to participate in it when I was studying. So thank you again so much. I'm glad to be here.
Good morning, everybody. It's James Revels. I'm the sole co-chair for career development, and happy to be here with you on this. We take you on this journey, help prepare for this course. Good luck with it today.
Next slide. Jessica?
Yes, and thank you. Yeah, we have a quick update for you, upcoming face-to-face education opportunity. If any of you are in the San Diego area next month on Thursday, November 17th, that will be the annual meeting of the Hospital Association of San Diego and Imperial County. That is the local council of the California Hospital Association. If you have opportunity to participate, also there is a Northern California Council, and they also have an annual meeting every year, I think usually in September. So we partner with the California Hospital Association, and we give them some of our face-to-face credits. And so this actually will be our first face-to-face panels in person this year. They have 3 panels. One is a qualified education on behavioral health. Second one is on emergency preparedness, and a third one is on leadership topics. So I will drop more details into the chat so you can see the agenda and hopefully register, and hope many of you can attend. And yeah, thank you very much. That'll be our last face-to-face education for 2022. Thank you all. Oh, and sorry, and thank you again all to everybody who participated with the annual conference. It was a great event. We had over 160 people attend over the course of the 4 sessions, and appreciate everyone being a part of it. So thank you again.
Thank you. Next slide, please. Okay, so we would like to bring back the BOG exam tips, test taking tips. So just to remind everyone, especially if you're taking the exam, relaxation, breath, proper breath taking, clear thinking, clear your mind, focus. So it's really important. And during the exam, don't forget to read each of the options as true or false, and elimination. You have to eliminate which is right or wrong. And keep on rereading each question. So beware also with the with the words such as all of the above, all except, or other I call it distracting words that would, misalign you with your thinking. Don't stress, don't stress. The exam has 6 hours for you to finish. So take breaks. If you feel like you're fully loaded, your brain is really shrinking, or brain is exploding, take a break, and refocus yourself. It's really helpful. I did that when I took the exam. I took 2 breaks actually, because I feel like I'm tired. I feel like that I'm done with this, and I'm only halfway through. So I took breaks. So it really helped. And mark questions for review. So if you are not sure of the questions, if you cannot understand the question, just mark it for review before you finalize all your answers. Yeah, so those are just a very helpful tips from us. And if you have any other tips, Nora, would you be able to add some of the tips?
Particularly when you're reading and rereading the question, again, one of my favorite tips is to read it backwards. Last week, if you recall, a bunch of us missed the word "not" in one of the questions. It wasn't until I read it backwards again that I caught the "not." So that's one of the ones that I found most successful when I forget the answers to all these sample questions. And so I have to constantly put myself back in your shoes and like read the questions, including backwards.
Okay. Okay, thank you. Next slide, please. Okay, I think this is for Twee to introduce our, facilitator for management and leadership knowledge.
Yes, thanks, Michael. So I would like to welcome James Revels. We actually worked together back in the good old days when I was with the Seoul chapter in San Diego in 2019. So it's great to see James' progression and promotions within the committee, and it's such a pleasure to have him join us today to speak and walk with us through these sample questions. He is now the director of for Kaiser Permanente for the financial planning and analysis department, and he's just a wealth of knowledge. Graduated from UC San Diego, and even has been a lecturer there. So this is a warm welcome and a warm applaud for James to be with us and talk with us with management and leadership. Thanks for being here, James.
Oh, no, thank you, Twee, for the great introduction. And I'm happy to be here, and I'm happy to be, as I said, on this journey with you all. So, when we go to the questions, if you have questions, feel free to put that in the chat or ask questions, it's fine. So I'm happy to stop and help explain or as those questions come up. Okay, next slide. Okay, so let's, I'm just going to touch on a few of the topics we'll talk about today. So we'll get into implementation planning. This is building your strategic plan as part of your business. We'll talk about really a whole host of business topics, such as contingency planning, and that's for preparing before an actual emergency happens. We'll talk about organizational systems theory, and that's really about analysis of productivity and performance of your organization. We'll talk about a lot of different management functions, such as planning, organizing, directing, controlling, and how that's applied, and just a bunch of different leadership styles we'll touch on as well. Next slide. Okay, so we'll get into some team building techniques, and particularly on conflict resolution. We'll talk about a bunch of different organizational development resources that healthcare institutions use, such as surveys and team building and sensitivity training. We'll get into collaborative techniques. This is, again, engaging, working with physicians and resolving conflicts. And then really important is the diversity and inclusion principles. We'll touch on a lot of that as well. Okay, let's go to our first question. Okay, so this question asked is a transformational leader adapts and applies evidence-based leadership in their practice, and the application of evidence-based practice in healthcare management is more challenging compared to the clinical practice setting because, well, before I get into this, they threw a couple of terms out in this question, and there's a lot of words in what they're asking you, so didn't want you to get distracted by that. But so they're asking about transformational leader, which is really a management philosophy that really encourages and inspires your employees to develop and look for new ways to improve your company's, put them in a position for success, and that's using different types of methods to solve problems. And also, the question also asks for evidence-based practice. And this is really, these are early adopters are looking at basically evidence-based data to solve problems or inform practices among the staff. So this is kind of what the types of things they're asking about in this question. So, and again, so the questions ask, it's comparing this evidence-based practice in healthcare management versus more from a clinical culture setting. So the first question is, the first option in response to this question is, the culture in healthcare management is much less professionalized, with much less formal body of knowledge and great diversity among practitioners. Well, what we do know in healthcare is in the clinical culture, it is very highly professionalized, and they do have a formal body of knowledge that's used, it acts as a frame of reference for dialogue and debate among providers. So certainly from the clinical culture side, there is a formal body of knowledge, and it's they use as they address clinical related questions. Now, healthcare management, on the other hand, I think is probably you're looking at a diverse group from different professional and disciplinary backgrounds, but they may not have share that similar language or terminology as they discuss issues or problems. So I think option A, in response to this question, says the culture in healthcare management is much less professionalized, a much less formal body of knowledge, and great diversity among practitioners. I think that may be true. So that's a possible answer to this question, but let's look at the remaining choices. The decision in healthcare management is supported by various systems such as handbooks and guidelines, making it complicated. Well, I think there's that formalized information probably exists from a clinical culture perspective, but I'm not sure that same thing exists on the healthcare management side. So not sure that would be a good option for us. Now, C says the difference of the content or context of the research evidence from a clinical perspective to a management perspective is non-comparable. Well, I think that's true. Certainly, from a clinical perspective, they look at more experimental methods from a randomized control trial versus management is more from an academic approach where they're observing methods of doing things. So, but this is more, I think, a distractor because it's really not addressing the questions being asked. So I'm not sure I'd choose that as an option either. And then finally, the culture in healthcare management is highly professionalized with a strong formal body of knowledge. Well, I think they're describing a clinical culture in this case. So I'm not sure that would appropriately answer the question. So I think the answer to this question is probably I would choose A as a response to the questions being asked. And what's the answer? Okay, A. So that's again, it's they're oftentimes in some of these questions on occasion there may be distracting information in there, but I think when you get into a complex question like this, maybe break the reread your question as part of the test techniques, and if they're using terms, just make sure you understand the terms that are in the questions that are being asked. So that's kind of what I would advise as we go through something like this. There's a more complex or complicated question. Next question. Okay, so the U.S. healthcare industry is highly diverse and addresses the ongoing challenges of workforce diversity. And an organization should. So when we talk about workforce diversity, you know, having a diverse workforce is you're gaining access to different perspectives, and it's about bringing together people with diverse backgrounds and cultures that really help improve an organization's ability to address problems, to solve problems, and empathize with patients. So the first choice to answer this question is A, expand the market share by adding or enhancing services that target a diverse population. Well, I'm not sure that that would actually address workforce diversity. I wouldn't choose that as an option. Let's look at the second one, B, develop a linkage between the marketplace and the workforce that will enhance recruitment, development, and retaining of employees. Well, that could be a possible choice. It's improving ability. It does impact recruitment. But again, let's look at the other choices. Develop a diversity education tools available both to the workforce and to the community. Certainly, that would help with the communication gap, but may not be the best answer to this question. And then finally, there's D, implement and develop and implement workforce policies and management practices, maximizing the talent and productivity of employees with diverse background. So certainly developing training and developmental programs to educate staff about recognizing maybe an unconscious bias to challenge assumptions and create opportunities for minorities and women who may receive fewer assignments that can really spur career growth. So I think out of the choices, I would probably choose D as probably the broadest answer. Okay, it's D.
Just a quick comment on
Sure.
that. To James' point, I think we should always be looking for the broadest answer. I'm sure we can see option A, for example, that does help in some way to bring in workforce that is more diverse based on what you do for the community, or to even retaining some of the employees. But as you move through the options, always keep an eye out of which is the best answer that actually encompasses a lot of these and kind of in the broadest perspective.
Yeah, because there could be several, to your point, there could be several correct answers here, but we're focusing on the most broadest answer to this question. So as I read through it, I said, well, you know, a lot of this makes sense, but again, I was focusing on, you know, an answer that would cover more broadly the questions being asked, and that would kind of help eliminate some of the other options. Okay, next question. So the purpose of the Capital Expenditure Committee is so it's is it A, to oversee appointment of competent medical staff to render care for the service area? Well, really, that's the responsibility of the hospital's board, who has legal authority over the medical staff. But so that's I don't think I would choose that as an option. It's not really related to capital. B, to appoint an effective governing board based on the wishes of the medical staff. Well, this is really you know, the responsibility of the board as a whole or a nominating committee. So again, not related to capital. C, to be responsible for evaluating and prioritizing requisitions for new equipment. Well, new equipment, that's capital. And requisitioning that means they're going to have an expenditure. So those are two big clues, you know, that C may be the best answer. But let's look at the last one. D, to implement stakeholder wishes on the future direction an organization should take. Well, that's really the responsibility of the CEO and the executive team. So I think C sounds like the best answer to me. Okay, C. I think this one was more obvious in terms of the choices that were given, but again, it's kind of breaking that down and looking for clues in the answer that are provided. Okay, let's look at the next one. Okay, an emergency disaster preparedness plan includes triaging arriving injured, coordinating with other community resources, and hours of operation. Well, although this is important, this is not generally part of the emergency disasters preparedness plan. So I'm not sure if I would choose A. B, an active command structure. Well, an active command structure does set the incident objectives and priorities. It does have overall responsibility for that incident or emergency event. So that could be a possible answer. C, payment for hospital personnel. Well, this is something that occurs after the disaster is over to cover any extraordinary costs incurred during the emergency. So I'm not sure that's part of the disaster preparedness plan. And then D, regulatory approval from CMS. Well, CMS doesn't require an improved emergency preparedness plan. Again, probably not part of the emergency disaster preparedness plan. So I think I would choose B is probably the best answer here. Okay, B. Let's go to the next question. Committees are important primary tool primarily because A, they provide a mechanism for reconciling differing opinions and facilitating decision making. Well, what I do know about committees is it does involve members in the development and delivery of service for a company. They do represent member opinions through decision making, and they do help serve members' needs through interaction. So that sounds like a lot. Based on the definition, A sounds like that may be a pretty good option, but let's review the rest of them. They are the only way for providing inter-staff communications. Well, not necessarily true. I mean, formal staff meetings could also serve in this function as well. So not sure B would be our best answer. C, they keep staff up to date of new professional developments. Well, outside continuing education courses can accomplish this task as well. So not sure, this would need to be addressed to a committee. And then finally, D, ensure self-expression and participation by staff. Again, this is something could be developed through other types of meetings or even through a formal staff meeting. So I think I would choose A as our best answer here. Okay. Next question.
Can I interject something before you move on? The word only is always going to be a red flag for me. Always and never. Never say never, never say always. So if you see any of those extreme words, you can probably identify exceptions. That means you can eliminate that as a choice.
Yes, thank you, Rick. That's a great point. Okay. Which of the following is not an executive office function? Okay, again, there's a distractor in here, so it's not. So just focus on things that are false, versus normally you would look at something that's actually true. So this is kind of so you just want to make sure you go back and reread this question. Make sure you're selecting the correct option. So what we do know about the executive office function is these are primary responsibilities. It includes making major corporate decisions, managing the overall operations and resources of the company, and acting as a main point of contact for communication back to the board of directors. So first option is A, control. Well, excuse me, control, it is a management function, and it's done to really help check for errors and take corrective action. And ultimately, it helps minimize any deviation from standards and really make sure we attain the stated goal for the organization. So all this, no question, it's a management function. I'm not sure it's part of the executive office function. So I'm not gonna, so again, we're looking for this not an executive office function. So let's look at the other options. Lead. Well, in executive office functions, they are leading, they're making major corporate decisions, they're providing strategic decision. and they're managing the overall operations of the company. So I think that fits well within what an executive office function is. Now, C, supporting, they are executive offices ensuring professional level support and service back to our board of directors. So again, that's not, that is an executive office function. And then D, represent, meaning they're acting a main point of contact between the board of directors and operations, and also their outside clients. So I think in terms of what's not an executive function, I think control probably would be our best choice. Okay.
Yeah, and if I may add to that, the control function is mostly at the subunits. So mostly it's the management, the managers. So
Exactly. Yeah. So it's really, yeah, just have to make sure we understand that in context with what they're asking about. Okay, next question. Okay, so this one asks, which of the following statements in accordance with the principle of delegation? Well, let's define delegation. And it's really about assigning authority to another person to kind of some specific activity. And it's a process of distributing and entrusting work to another person. So that with that definition, it's asking A, the executive who subscribes to the principle of delegations knows what he or she wants to accomplish and exercise control over the work schedule of the subordinate. Well, they're mentioning control. So that tells me that probably doesn't fit within our definition of delegation because they're controlling something. B, an executive explains how he or she wants things done and points out how the subordinate's contribution fits in the overall plan. Well, if they're explaining how they want things done, they're really not delegating authority. So B would probably not be a good choice. C, a successful executive gives instructions telling subordinates exactly how and what sequence they want things should be done. Well, that sounds like they're micromanaging and probably the exact opposite of delegation. So I'm not sure C is a good choice either. And then finally, D, in applying the principle of delegation, an executive makes relatively few decisions and personally and frames orders in broad general terms. So yes, they're describing in general what they want done, but they're delegating the authority to carry out this direction. So that I think that does fit well within our definition of what delegation is. So I think I choose D as our best choice. Great.
Our participants are on a roll.
Yeah, yeah, they're doing well.
Yeah.
Okay, next question. Okay, what is the correct order of stages for accomplishing organizational change? Is it A, identifying, planning, implementing, and evaluating? B, planning, identifying, evaluating, implementing? C, evaluating, planning, implementing, and identifying? Or D, planning, evaluating, identifying, and implementing? So I think in this case, if it's not immediately obvious, you can think of it in this terms. First, you want to identify your problem. So that gives you probably, that's your first step in able to eliminate practically all the answers, what the nature of this is. And then you're creating a plan for change, which is planning, and then you're implementing, you're putting your plan into action, and then you're reviewing your results. So I think A represents, and it was, I think, obvious in this question that's being asked, is our best choice. It looks like everybody got it too, so that's great. Okay, in the healthcare field, the accountability of management is best measured by, so A, balance between service quality and operational efficiency. Well, that seems like a pretty broad metric. So that really could be a good possibility, but let's look at our remaining choices. Results shown on the annual expense and income statement. Well, that's really one metric, and probably not a good one to measure the accountability of management if you're just looking at a single metric like that. C, balance maintained between physician satisfaction and patient needs. Again, these are very specific metrics. So we'll probably need something a little bit broader than that to measure how accountable management is. And then D, degree to which management needs are met. And again, not sure how this would really fit in to measuring the accountability of management. So I think our broadest choices among the metrics that are mentioned are probably A, balance maintained between service quality and operational efficiency. Okay, again, it's about selecting the broadest answer, and among all those choices, B, C, and D are very specific things, and A represents a very broad thing in terms of measuring accountability. Okay, in a dispute between two physicians, the primary role of the chief executive officer is to, well, let's talk about what the CEO is responsible for. They do plan out the company's overall strategies and policies, but more than that, they have responsibility for all components in all areas of the business. So with that, would it be A, ask a representative of governing authority to mediate dispute? Well, no, they're responsible to make sure this dispute is resolved. So I'm not sure I would choose that as an option. Avoid any involvement in dispute, definitely not. They have responsibility to make sure it is resolved. C, meet with both parties as soon as the problem is identified. I think in this case, as we saw in the prior questions, this probably would be an opportunity to delegate their authority. So that would mean possibly the CEO would delegate this resolving this issue to the chief medical officer. So not C, I wouldn't need to choose C either. And then I think finally D, request the appropriate chiefs of service to investigate and report back. Yes, they're delegating their authority to resolve this issue, but still ultimately are responsible for making sure it gets resolved. I would choose D. Yeah, it looks like everybody got that right as well. That's great. Okay, so for most members of a well-managed organization, the front office is a source of authority. Well, they're really providing, the front office is really providing, they maintain a database of guest information, they're coordinating services and ensuring a guest satisfaction. So they're more providing information, I think. So source of authority probably wouldn't be a good choice. They are a resource and a guide. So they're directing, they're providing information back to our members. A major C, a major stockholder. Well, they are a stockholder. Employees are, a stakeholder. Employees are stakeholders, but I'm not sure that really addresses the question that's being asked. And then D, a decision maker. Again, they're providing information, but I think in this case, their primary role is coordinate services. So I think I would choose B as our best answer. Okay, great. And next question. Okay, the cultural climate of organization affecting its recruiting procedure because A, it reduces employer turnover and absenteeism. Well, I don't think this would necessarily affect recruiting, the recruiting procedure, reduction in turnover, people being absent. So I'm not sure that's a good choice. Organizations seek applicants whose attitudes, values, and goals are consistent with those of the organization. Well, yes, that definitely, they're looking for people who share the same, goals and values as the organization does. So that definitely would affect recruiting, the recruiting procedure. But let's look at the other options. C, applicants who cannot support a given culture will be unwilling to work for that organization. I think generally that they may be true, but I don't think it necessarily affects recruiting, the recruiting procedure. And then D, applicants look only to organizations that portray a positive culture climate. I think that's very important to applicants. But again, they're asking about on the recruiting side. So I think probably B is more directionally answering this question. So that's what I would choose as an answer. Yep, it looks like people have gotten that. That's kind of what others have guessed as well. Okay. Oh, that's it. Wow, that's great. Any questions I can help answer of what we went through, or any questions that you want me to go back over that's not clear?
So-
Jane, oh, go ahead.
No, go ahead.
There's a question or a note in the chat that says the last question seems to be HR items. So I think there are some some questions in every body of knowledge that sometimes you think it's HR, sometimes it's finance, so they are overarching. So you will find questions such as like this.
Yeah, exactly. I also think it's, you can look at it as a general business approach on how we do business. Yep, Matt, yeah. Yeah, thank you, Rick, for that. Again, there's a lot of, there are some overlapping in many of the areas, so.
James, can I ask a question?
Yeah.
If you were sitting down to prepare for this area, what would you emphasize?
Well,
what's the best use of people's time?
Yeah, so I think a lot of the questions have terms in them. So I think it's helpful to make sure you know the definition of the terms being asked. And I know a number of the questions that they had distractors. So a lot of the choices really wasn't answering what the question that was being asked that I noticed when we went through that. So going back and rereading the question a second time and then reading the choices, I think would be helpful because that would help you eliminate a lot of the questions. And because as I went through the questions, I was able to eliminate some of the choices because when I reread the questions that being asked, it really didn't even address at all the questions. So you could eliminate some of the choices just by doing that and then getting down to maybe two choices and what you have to answer for. And again, at that point, you're looking really for the broadest answer because two or more options may be correct, but you're looking for the broadest term response to that question. So those are a few things that I would mention that would be helpful in terms of test techniques.
So I was thinking more in terms of preparation, when you're sitting down to study, where do you want to emphasize? And for example, it seems like you really need to know the roles of the different levels of management.
Yes.
What about management theories? Are those important?
Yeah, I think generally knowing, understanding the different areas, the different organizational structures and what they're responsible for would help. Like I think there was one question about the CEO. So understanding what executive management has responsibility for, which is more strategic in nature versus what line managers have responsibility for, which is more day-to-day operational management and planning. So I think understanding the roles and responsibilities at those different levels would be helpful in terms of studying. So that will help you really prepare well to answer some of these questions.
So in addition to that question, Rick, if you don't mind me adding to that, if I will be preparing for this exam, I would take a look on the different leadership styles because mostly it's a situational. So it's basic knowledge on leadership styles and how would you apply that. Mostly it's application. The differences between managing and leading, those kind of stuff. So mostly in the questions they will give you a situation. Is that a management or leading, something like that? So really you have to look into those differences.
Yeah, I think one thing I would add to that is understand the difference between and they are very different definitions, but understand the difference between management and leadership. And I think that gets to, really the very crux of the, a lot of the way these questions are being asked.
I want to respond to a question about whether just having this webinar and flashcards are enough for the exam. Again, going back to what we originally said, this webinar is especially intended just to help you focus on how to understand the questions, how to interpret what the questions are asking. This webinar does not present everything that you need to know and research. The flashcards are excellent. Rick indicates that the Well-Managed Healthcare Organization reference that ACHE provides, the study bundle, are excellent resources as well. So I wouldn't depend on just this webinar or just the flashcards. But again, we're trying to be very careful in this webinar not to make you think that the PowerPoints that we're presenting to you are the only things that you should study.
And give yourself 6 months to 1 year to prepare.
Right.
But I mean, you really have to look at your own knowledge areas. All of us probably feel comfortable in one of the 10 areas, maybe 2. And then there's other areas that terrify us, finance, quality, whatever it is. So, look at what your strengths and weaknesses are and then put your time and effort into those.
Yeah.
They need a separate finance book. You may need a separate HR book. Just depends on what you feel comfortable with.
Yeah, no, that's a great point, Rick, because even some of the questions I went through, I mean, some of that I drew on my past operational and, business knowledge, and it did help answer some of the questions. They were kind of outside, what I do. So I think applying your own experiences would definitely be helpful in relating to these questions.
Also, just to add a comment, the books that you may have sometimes are not the latest, and don't underestimate your current or past experience in your own specialized world. For example, in the exam that I took, there were a couple of questions on value-based care, which I was handling in my current business, but I don't think I've read in any book that I have actually purchased from ACHE. Part of the continuing education that ACHE promotes and all chapters do is really bring and keep you updated on what's going on in the healthcare industry as well. So it's not about a context of 10 years ago, what is relevant. It's also about what's happening in the last few years and what's happening currently.
And at the beginning of the webinar and at the end also, again, one of the references to look into, ACHE on their website provides the competency, your self-assessment and competencies. And that has been very, very helpful also to help people target where they feel that they need to beef up their knowledge areas.
Okay, so if there's no more question, let's go to the next slide, Tui.
Thank you, James. It was a very engaging discussion. Hopefully a lot of us on the call have benefited from it. I'm pleased to introduce Michael DeCoco, our very own chair of Advancement Committee. I've been working with Michael for the last at least 3 years, if not longer, since I joined the Advancement Committee. He comes with well-respected credentials. Academically, he's a doctorate in hospital administration, which I don't think he mentioned it here, but he's also an assistant professor currently teaching on healthcare topics as well. We are pleased to have him lead our team right now for the last year or so. He's also been, in addition to being a fellow himself, he's been on the BOG test writing workshop as well that takes several of these volunteers' expertise in actually crafting questions for our exams. I couldn't, in terms of the benefit that we all get and the applicants get, it's invaluable. I'd like to welcome Michael to take the floor.
Thank you, Shashan. Thank you very much, and glad to be here. I'm glad to be of help to members who wants to move forward and grow and become a fellow. So thank you. Next slide, please. So I guess I am tasked to discuss or discuss the questions about business, the business knowledge. So business knowledge is a kind of when I was preparing for the exam, it's a big section. So for me, it's like a mini MBA actually. So if you are a MBA graduate, I think you have a edge on this, or edge on this knowledge, because mostly you've taken this in your MBA classes. So few areas to focus on the business knowledge, or one is the strategic planning. So it's really important. Conducting business in the healthcare market, marketing functions, all of those knowledge are important. So they are shown in the on the slides. So the also impact of the socioeconomic and on the environment. So those are some few topics that you have to know in this umbrella. So next slide, please. So the marketing principles. So you have to refresh your knowledge on the 4 Ps, marketing analysis, all those stuff, research, and advertising, your social media relations, the negotiating of contracts. It's really important. So utilization review, those kind of examples. And some, and the impact of business decision to the operations in healthcare. So it's also important to know. And I think we are ready to go to the questions. So first question. So question is the element most critical to the successful design and implementation of, I cannot read whole, sorry, of an executive decision support system in a healthcare organization is. So it's pretty much obvious, that the answer, but I would like to read this question backward, as Nora said this a while ago. So I'd like to take the important, terms here, like executive decision support system. So what does executive decision support system? Who are those people involved? That's the key to that. And the another one is the critical to the successful design. So those are the 2 terms that I'm going to be considering in this question. So let's go to the different selections. So selection A is availability of software for updating the database. I think this is a resources or tools needed for a successful successful design of a project. So B, maintaining data confidentiality. I don't think this is related to the question, which is I would consider this as a distractor. And the C, involvement of top management. And D is the availability of network computer equipment. So I would say the answer here is C. And what's the answer? Yeah, C. And most of you got it. Got the answers. The answer. The selections A and D are tools or resources that are needed for a successful implementation of a project, sponsored by the executive members. So that's how I'm gonna dissect this question.
Just to add one comment to it, this will probably come up in your kind of an overlap into the IT side of the exam as well, which is anytime you're building a software system, it's vital that the end users are a key part of that definition, requirements, and all the way through testing and rollout. A lot of times software projects fail because you don't engage with the end users early on.
Yeah.
So it's kind of an example of where, in this case, for an executive decision support system, in addition to being the stakeholders or the key stakeholders, they're also the ones signing off on the budget. So it makes even more sense. But just keep that in the back of your mind, that users have to play a big part as you build anything software related.
That's a good point. Thanks, Shashan. And yeah, this is part also of the business planning. The related to IT strategic plan. So next question. What is the fundamental reason for joint ventures between healthcare organization? So it's asking about ventures. So the topic, the question is talking about ventures. So selection A, they are allowed by EMTALA. I don't know how is EMTALA related to joint ventures. EMTALA is mostly in the ER regulations, right? B, they are formed because they offer legal routes to cooperative efforts. I would leave that as a true for now. I will not eliminate that. C, they are permitted as means to share clinical and quality advancements. Yeah, but it's not the broadest answer, or it's not the the high road answer that I consider. And D, they are created to lower overhead costs. Will they, if there's a joint venture, will it create a lower overhead costs? So let's look at the answer here. Yes, they formed because they offer legal routes to cooperative efforts. So in these questions also, I would like to remind everyone that this is related to merger affiliation and the vertical and horizontal integration. So maybe you heard that in one of your PowerPoint or the recording that we sent. So really, you have to also learn the difference between vertical and horizontal integration. The question is mostly an application. So if this company offered these services or did merger to this company, what kind of integration? That is the question that you're going to be encountering. It's mostly application. So difference between vertical integration and horizontal integration is really important to know on this.
Michael, can I jump in on this one?
Sure.
The question is asking a reason to do something, and both A and C are saying they're permitted. And just because something is allowed, anyone who has teenagers knows this, just because it's allowed doesn't mean you ought to do it. So I would eliminate A and C just on that they're really not responsive to the question.
Yeah, I think I would also add that if you just understand what the definition of a joint venture is, that would give you a pretty big clue in what the answer is. So again, it's just understand some of the terms in the questions being asked.
Yeah, that's a good point. Yeah, so always understand, reread and reread. So let's go to the next question. Okay. Which of the following is an uncontrollable factor in marketing plan? So it's uncontrollable factors. So something that you cannot control, right? So selection are A, economic environment, B, budget, C, personnel, D, creativity. So I would I would select start the elimination from the creativity. So is creativity related to marketing plan? I would probably say no. Personnel, you can control personnel though, right? Based on your volume, based on your operations, you can control personnel. However, are they part of the marketing plan? So that's how I'm gonna analyze this question. And the budget also. So budget, you can control your budget, are also related to your resources, to your, well, related to your, you know, productivity or people or resources or expenses. So you can control those. But the environment or economic environment, I think that it's hard to control because there are various, you know, forces that is, you know, controlling the economic healthcare environment that we cannot really control, such as, you know, the technology, the you know, the regulations and various issues that is related to healthcare. So mostly it's related to the environment. So let's see, I would choose A here, economic environment. So what is the answer? A. Any comments on this?
Yeah, Michael, the other, I would say all four could impact your development of your plan, but B, C, and D are all internal factors, and A is an external factor. So if you're looking at what's controllable, you can control things that are internal, or more likely to be able to control them.
Yeah, that's a good point. External and internal factors in marketing plan. That's a good point, Rick. Thank you. Next question, please. Okay, this question is for me. It's there's a lot of words, so I would probably slowly, you know, read this if I'm taking the exam. So, when contracting for services, an organization typically finds the best value when A, the organization creates an internal auditor position to oversee the service. Internal auditor to for contracting services, I don't think we need that, right? A board member negotiates for discounted services. Board member is not involved in the contracting services in the operations for healthcare or hospital. They are more at the higher level functions. C, the organization allows the prospective supplier to develop a contractual service expectations. Well, that's kind of maybe true, because, you know, there should be a you know, contractual service expectation between the two, between the supplier and the organization. And the D is there is competition between several suppliers with proven performance and reputation, So I think most of our participants are giving us their D. And what's the answer here? I would probably see D also. So this is more on knowledge about contracting, and competition is really important, right? For suppliers, the more competitors or competition, the better outcome of pricing that you will get, right? So that's how we do it in the hospital. So knowledge on review of proposals, you know, RFI or RFP, something like that. Because the more competitors, the more vendors who would compete, you'll get more value in terms of pricing and services for any service that you are trying to get from the outside vendor. James, you have any addition to that?
Yeah, I think that makes sense.
Yeah, okay. So next question, please. Okay, so when data is scarce, the best method of forecasting is to use A, computer-based simulations methods, B, time series analysis, C, econometric forecasting, or qualitative techniques. So let's see what is the answer from the participants. They are giving us B. B. Okay. So let's try to analyze this question, because so the question is asking for another method when your method is scarce. So there are two different methods of collecting data, right? The qualitative and quantitative methodology. So computer-based simulation methods. I don't think this is a computer simulation. I would say this is not the correct answer. So B, time series analysis. This is mostly analyzing data sequence in a graph method. C, econometric forecasting. I think this is a tools that being used by mostly economists in forecasting some economy or money or some in the business economy world. So D is the qualitative techniques, and I would say that the answer for this is D. Let's see the answer. So qualitative techniques is the answer in this question, because so you are forecasting. So your forecasting is predicting without good data. If your data is scarce, using the quantitative, you can your best method or best option is to do the qualitative, which are the interviews, surveys, or interview of a focus group. So that's why the best answer is the qualitative techniques for this.
Michael, this is another one where one of the four is different than the other three, which is the way of at least pointing you to one of them. The first three all require numbers. The fourth one does not require numbers. Right? So just if you can notice that one of them stands away from the other three, it definitely is worth looking at that one particular.
Yeah, thank you, Rick. And there's a comment here also from the participant that says, also, if you don't have enough data, you can do computer-based simulation from Connie. So.
You can, but if you have no numbers to tell you what the reality is, then the simulation is probably not going to tell you much either.
Yeah, I think the point on this one is that all A, B, and C all require data to do analysis, and that's why D is the obvious.
Yeah. Okay. Yeah. Thank you. Next question. Okay. So this question is about decline of a product. So most products and services enter a period of decline. Unless compelling reasons prevail, continuing a declining product or service is costly because A, increased turnover of personnel will occur. B, continuation will set an undesirable precedent concerned with maintaining the status quo. I would probably say I would leave this, probably a possible answer. And C, the program will consume a disproportionate amount of management time and delay the search for a replacement. Another possible answer. And the D, organization will be perceived as being insensitive to the marketplace. So the selections looks like all the selections are correct, right? Are true, but what is the best? What is the broadest answer to this question? So are you ready to find the broadest and best answer to this question? So the participants are giving us C, which is, what's the correct answer? C, yeah, C. So this question mostly, as I mentioned earlier, it talks about period of decline for a product. So you should probably go back if you haven't encountered this in your review, in your preparation. You should probably go back and learn about this. So the selections A, B, and D are results of or effects of mostly if you're continually offering the product of service, these are the effect, right? Yeah, the effect is there's a lot of turnover for personnel, especially if you have a archaic system. They will go to a different organization that has better system, like so. And B, continuation with an undesirable precedent concerned with maintaining the status quo, it's a bad effect also. And the D, organization will be perceived as being insensitive to the marketplace. So another effect of a declining product. So C is the best answer because it is the broadest that talks about the period of decline of a product. And there are different types of organizations. They are like early adopters, middle adopters, and late adopters. So I would also probably go and research on those different types of adopters in healthcare. Okay. Any next question? Oh yeah, we're in the number 7. So so number 7, so before submitting a business plan for a new clinical service line to the governing body, the plan should be developed by A, recommendations from the finance committee on the basis of its estimate of income for the budget year. B, the heads of the profit centers, considering each center's anticipated revenues and expenses, with the CEO putting it all together. C, key executives after reviewing recommendations from the heads of operating divisions and key physicians leaders. And D, the heads of the operating division with CEO putting it all together. So we're looking for, again, I would go the high road answer here, or the best broadest answer in all the selections. So so let's try to dissect this. So selection A says recommendation from the finance committee on the basis of its estimate of income for the budget year. So this would be the decision only basing from the finance team, right? So and selection B, the heads of the profit centers, considering each center's anticipated revenues and expenses with the CEO putting it all together. I would probably leave this as as a possible answer. And C, I would leave that also as a possible answer. And D, CEO putting it all together, that's impossible, right? So what's the right answer here? Next, C. So key executives after receiving recommendations from the heads of operating division and key physician leaders. So this is part of the budgeting, actually, right, James? It's this type of budgeting is coming from the.
No, it's not budgeting.
It's not okay.
No. It's I mean, these type of things are considered when you develop a budget, but it's outside the budgeting process.
Okay.
And I think the point here is you really need, it's not a finance function. Necessarily finance has input, but you need you need input from operations. For
a business plan, yeah.
Building the business plan. I think that's what they're trying to get across.
Yeah. Okay. Thank you. So yes, it should be coming from key executives after the recommendation. So it's the broadest answer, right? It's involving the collaborating with the department heads or the people responsible in the department. Next question. So in this question is about environmental assessment and scanning. So environmental assessment or environmental scanning is a formal surveillance review of the organization and its environment. All of the following should be taken into consideration into account by the planning unit. So take note on the last sentence, all but one. So these are the distractors or the words that we have to be mindful in taking the exam. But one should be taken into account by the following unit: A, community demography, epidemiology, and economy. I would leave that as a possible answer. B, trends in physician availability. Physician availability can also be you know, a factor in the environmental assessment. See, niche strategies. Honestly, I haven't seen this question, so so weird question. D is patient community attitudes. So I would invite the committee to give an input on this. So what's the answer here?
Well, Michael, like that other one I commented on, you've got 3 that are external and 1 that's internal. So the community demographics is in your environment. Physician availability is in your environment.
Mhm.
Attitudes in your environment. But your niche strategy is something you are creating. You're creating the strategy. So it doesn't really apply to environmental assessment. It may result from your environmental assessment. So if we're looking for 1 to eliminate, again, you know, it's 3 to 1, and I would eliminate the niche strategy C.
Mm-hmm. So because the question says but one are of the following should not be taken, right? Yeah. So the answer is, what would you think with the answer, Rick?
I would say C is the answer.
Yeah.
It's the only one that's not part of your environment.
And the answer is C. Okay. So environmental, yeah, you're exactly correct. It's about external and internal, you know, elements in your environment. So
but it's also asking which of them is different than the other 3.
Yeah.
You know, it's kind of like a game you probably played when you were kids of, you know, which one is different. If you can do that, particularly when it's telling you to eliminate one of them, then look for which one doesn't look like the others.
So if I will simplify this question, it says all of the following are part of the environmental assessment or scanning except, right? Except the niche strategy. Is that correct?
Yeah, that's a perfect way of rewriting
Yeah.
it.
So this question is kind of weird, right? Someone just put a note here. This question is weird. So this is how, you know, how the questions are written. It's written by different professors, you know, in ACHE. So they try to really convolute the questions and make you think a lot. So this question would just very simple to me. All of the following are environmental assessment are needed in environmental assessment except. So that's how this answer is derived. So niche strategies. So, okay. Next question, please. So hospital systems have many customers. So another like an exact question. Of the 4 mentioned groups of people or organization below, which is least likely to be listed as a key targets in marketing campaign? A, buyers. Buyers are the #1 targets for marketing. So campaign, correct? Caregiver exchanges, yeah, they can be a target of marketing campaign also. C, state government, don't think so. And D, patients. So basically, in this question is saying all of the following are all your target audience for marketing campaign, except I would say C. And the right answer is C. Yeah. So all of these A, B, and D are all your, you know, as I said, target for marketing campaign or marketing advertising. So except for the state government. So you go to the to the state government to lobby, right?
Well, at one point, California did competitive bidding for Medicaid, and at that point, state did become a customer. But a good reminder that we're looking at national, not a particular.
National, yeah. Yep. Okay. Next question. So a healthcare facility can best meet its social and economic goals by A, developing a realistic and coordinated approach to long-range planning. B, devoting most of its efforts to the development of efficient operational practices. And C, having a good public relations program which will focus the facility in the community. And D, providing all reimbursable services desired by the community. So let's see your answers. Okay, so we're getting A, social and economic goals. So developing a realistic and coordinated approach to long-range goal possible, because we can probably incorporate our social and economic goals in the long-range plan. Possible. Devoting most of its efforts to development of efficient operational practices. This is mostly internal operations efficiencies in your operations. And C, having a good public relations program which will focus the facility in the community. Public relations is good, but I don't know if the economic goals is being addressed on this. D, providing all reimbursable services desired by the community. So I think how could we provide all the reimbursable services if we have different types of patients, like the underinsured patients. I don't know if we can provide all their reimbursable services to them. So and always never. And the answer is, for me, I would choose A here. What is the right answer? Oh yes, A. Yeah. So I would like to invite the committee members to give some inputs on this, if you don't mind.
Yeah, so I think one thing I would say is when they talk about long range planning, a lot of the other options are mentioned should be considered as part of the long range planning approach.
Yeah.
I mean, I don't know about all reimbursable services, but certainly they would focus, there would be part of the focus in the long range planning. So I think that's probably key. And again, it gets back to what is the broadest answer in the option are given. And I think it covers, a lot of the other choices that are given. So it's the most comprehensive part of it.
Thank you, James. Next question. Oh, that's the last question. So I would like to open the table for questions and answer from the participants. Do you have any questions for us? So business knowledge. So basically, mostly it's more on, as I said earlier, business planning, marketing planning. You have to have your if you are developing a business, new services, new service lines. So you need to have involve your proper plan for that. So knowledge and proper planning, right? Like trend analysis or forecasting, those kind of stuff. So any other questions?
One comment I will have is, as Rick pointed out, when it comes to the business side of our domain here, the book, The Well-Managed Healthcare Organization, is the best resource because it covers all aspects of the business planning and all the way to the execution. And a lot of us, depending on which line of work you come from, you may or may not have a line of responsibility focused on some of those areas. So it definitely helps to read through the book. If I recall, the book actually has ways to highlight some important topics. It has tips on the side that some of them I felt were pretty beneficial to skim through. And if you read one book out of the four, I would strongly recommend that be the book cover to cover to kind of get you a good sense of it, because that's one area of domain which has a lot of questions, obviously, but we also don't get to experience a lot of those in our own jobs.
Yeah.
In some ways, I agree with what Session just said, that book is like the one resource that I think everyone ought to have. But in some ways, this is the hardest of the 10 areas to decide how do you study for it, because it includes so many different things.
Okay. Any? I think if you guys agree with me, we can give them the give them time, like 5-7 minutes. Are you guys okay with that? Any additional closing remarks, reminders for next week's event or next week's session? Nora, you wanna do something? Or you wanna add something?
Just, this particular session was very interesting because a lot of these questions were new for me as well. And
Mhm.
one of the things that Rick added that is new that we need to add to our overall test taking tips is to focus on if the question is asking something that's internal or external to your organization, then to focus on what of any of the answers are internal or external.
That's a really great point. Yeah.
Yeah, we hadn't quite focused on that particular piece, but I think that helped answer a lot of these questions. So we're going to be adding that. Our very last session, we're going to be kind of like closing comments. Again, re-emphasizing what we've already presented early to focus on, and then plus anything else we've learned. And one of the things that I would appreciate is to provide your feedback on the thing or things that you found to be the most useful. And you can do that in the comments when we send out the survey, the Survey Monkey afterwards. Because each of you are going to have your specific thing that you held on to and that you found the most helpful. And it could be something that was so obvious to us and we missed it. So we would really appreciate that, because we're building on this. And remember, this is your way of paying it forward to the next cohort that takes this exam. And remember, we're going to be asking you to send us your pictures and then help give your testament or your experience to the next cohort coming up.
Okay.
Nora,
Thanks,
can I just
Nora.
build on? Can I just build on what you said? The key thing for me is not necessarily the internal, external. That's a good example of it. But anytime you've got 3 that are in one group and 1 in the other group, such as the quantitative, qualitative. So external, internal certainly did work on a couple of these, but I think when you look at other types of questions, that won't apply, but the 3-1 will.
Okay. Yeah. Yeah. So so if there's no more additional tips or feedback, I would like to close the session for today. And reminder, next week we will be having 3 topics for our 3 body of knowledge. So we will be having the session from 10:30 to 12, because next week's is kind of heavy. So just a reminder for everyone. So
I think you meant 10 to 12, not 10:30.
okay, sorry, 10 to
Yeah.
12. Thank you.
Full
Sorry.
2 hours.
Thank you. So so once again, we thank you for being with us today and giving us your time for Saturday. Instead of you enjoying the Saturday morning, you decided to give us time to to help you prep for the examination. So thank you very much, and we hope to see you again next week. And take care and have a great weekend.
Good luck with your preparations. Thank you.
Thank you.
Everyone,
Thank
have a
you.
great weekend. All right, I think I placed the one person in the waiting room and we have everyone.
And we can start the recording.